So my name's Naomi Hansen and I'm the Veterinary Director at the North Coast Emergency and Critical Care Centre on the Sunshine Coast. So today we're just going to talk about ticks and tick paralysis. We do see a lot of tick and tick paralysis cases here on the Sunshine Coast. It's something that in the past people have thought that it's only a summer problem, generally from the October through to maybe June, July. This year we've actually seen tick cases all through the winter, which is somewhat concerning. Ticks are very small and they live all across the Sunshine Coast and the eastern seaboard of Australia. They are quite prevalent right here, right now at this point in time, and they will get worse over summer. So my first thought is if you have a pet that goes outside, dog or cat, please make sure they're on a tick preventative and their tick prevention is up to date. The next thing I ask all pet owners is to realise that tick preventatives are very good, but they're not a fail-safe mechanism, and that it's still important to check your pets every day for ticks, especially up around the head area, removing the collar at the time you do the checks, just because we do see occasional tick paralysis patients that have been on a preventative and their preventatives have been up to date. So I feel like it's something that's good and it's useful, but it's not the only means of preventing them. I think the hard thing this time of year is that we see a lot of tick patients, and the start of the season they can be quite bad, and it's quite traumatic for us and it's quite traumatic for the owners. And I think that if you have a pet, it's just wise to put a preventative on them. Now, as far as what signs to look out for and what to look out for if you have a pet and you're worried about tick paralysis, the first thing we generally see can be like mild wobbliness. Sometimes the pets will vomit or regurgitate or just be a little bit off for maybe a day. My first thought, if your pet is feeling a little bit off and they're on the Sunshine Coast in a tick area and they're not on a preventative, is check them over. When you're doing a tick search, it's important to start at one end of the dog and work thoroughly through the whole dog right to the other end of the dog. It's something that you actually let your fingers do most of the work, because the ticks are so small when they're actually attached, you probably won't be able to see them. So when we do a tick search, I generally start at the front and work to the back. So start at the head, at the muzzle, around the nose, and then around the rest of the face. Make sure you check in and around all the folds in the ears, and then run your hands down the neck. Always take the collar off, because sometimes they're hiding under the collar. Run through the armpits, in between all the toes, down all the legs, and just like feeling more than looking, I think, is important, because you won't necessarily see them, but you'll feel like a little bleb. And if you feel like a little bleb, go down and see if it looks like a little grey thing. It's quite possibly a paralysis tick. And the hard thing is, if there's one tick on your dog, there might be more. So don't stop searching when you find one tick. The best thing then, when you find a tick, is pull it off. If you're not comfortable doing that, just go to a veterinary clinic, they'll help you pull it off. But getting it off is really, really, really important. I feel like there's a few wives' tales about maybe pulling them off and causing trauma to the tick is going to inject more toxin. I don't really support that, but it's something that some people will be concerned about. In my opinion, it's more important to get the tick off and sooner rather than later, because the longer it's on there, the more toxin that's injected. And then keep checking. Now, if your dog is showing any signs of tick paralysis at the time you pull the tick off, so the signs can be as mild as maybe regurgitating or vomiting, to a bit of a wobbly gait, sitting down a lot, and then it progresses from the back limbs forward. So then they sit down a lot, they don't want to get up, they lie around, and then the back end, like the back legs tend to get paralyzed, and then it moves forward, and it affects the front legs as well. So then they're not able to stand up at all. And from there it goes to the breathing muscles, which is when it becomes more concerning. So the paralysis is what they call an ascending paralysis, works from the back end forward and then affects the breathing. The breathing muscles are important to life. So when it gets to that stage, it's quite critical. So what you want to do is, if you're worried about your pet showing any of these signs, check for a tick. If you can't find a tick, go and get someone else to check for a tick. Go to a vet clinic. The nurses are really very experienced at finding ticks. I mean, there are other things that can cause similar signs, but I think we've just got to be tick aware this time of year. And anything, like even my team, anything comes in that you kind of think maybe it's a tick, we check them. We check them every 4 hours while they're in hospital. It's really important. So, as far as the paralysis goes, it's ascending from the back and forward. I think the concerns are it actually affects the heart muscle, and the heart's important. It affects the breathing muscle, and breathing's important. It reduces your pet's ability to swallow, which means that they do sometimes vomit. And when they vomit, they're prone to like a pneumonia, because sometimes if they can't swallow, what they vomit up goes back into their airways, and that's a major complication of tick paralysis patients. And we do see it quite commonly. Another thing is they tend not to be able to urinate. So it's basically an overall paresis. And these patients, even after we're treating them, and we do have anti-serum that we can use to treat them, it takes time. Like it takes time for the anti-serum to reverse the signs that we're seeing. So it's not just snap and they're better. I think that's the main thing, is once you pull the tick off, even if they look okay, they can get worse for 48 hours after. If we pull the tick off and we treat them straight away, they can still get a little bit worse before they actually get better. And that's why a lot of our patients with tick paralysis are in hospital for, some of them like 48 hours, some of them 3 days, some of them end up in hospital for a week. It's pretty serious, so it's super important to actually keep up with your preventatives. I mean, we're fortunate here because we do have facilities that are more like a advanced facilities, so we can actually ventilate or put patients that are having breathing problems onto an artificial respirator, and that at least supports them when they can't breathe. It's something that ticks are, they're really bad. They're really, really bad, and it's something that's potentially preventable, and it breaks my heart every year when we see all these patients that are they're just having trouble breathing and they're having trouble walking, and it's something that, in my opinion, can possibly be prevented. So I feel like take-home message is put a preventative on your pet and check them every day for a tick, and don't be naive, because ticks kill dogs. And there are insecticides in what we use, but it's not anywhere near as bad as what a tick's going to do to your dog if it gets on there.